welcome everybody. It's great to see so many familiar faces and some less familiar faces here for me to talk about RIPIN's new strategic plan. And I want to start, and I hope I end this way if I don't, keep me honest, but I'm going to start by thanking all of you, our stakeholders, our friends, our community members for, first of all, for all that you've done to make RIPIN what it is today. And also for all that you've done to contribute to this plan. And I'm going to thank you in advance for all that you're going to do to help make it a success. I have a presentation that's probably about 15 or 20 minutes. And after that, I'll hang around. I'm happy to talk to folks, answer questions as you wish. My colleague Mark is here and he will be monitoring the chat and all that good stuff. So welcome and thank you. So why do we make a strategic plan? There's a lot of work actually to make a strategic plan, and it'll be a lot of work to follow it. So what's the point? I don't know if any of you have seen Alice in Wonderland. I actually haven't, but I've heard this story. Alice is wandering in the forest and she's lost and she doesn't know which way to go. And she encounters the Cheshire Cat, I believe is her name. And she says to the cat, you know, which way should I go? And the very wise cat answers, that depends on where you want to end up. And that's obviously a great point. And that really illustrates why we make a strategic plan. You know, here at RIPIN or in any other organization, we're making hundreds of decisions every day. We're deciding what to prioritize. We're deciding what to do first. We're deciding who to partner with on a grant opportunity. We're deciding where to hold a certain event. And we're deciding what positions to post. And making all of those decisions without having a concept about where it is we want to end up, we're going to be unlikely to end up in the place where we want to be. Alice in the movie, Alice says, well, I don't really care. And the cat says, then it doesn't really matter. But one of the special things about RIPIN's community, our workforce, and all of you that I'm really blessed for as an executive director is that a lot of you guys really do care about RIPIN and care about where RIPIN ends up. And so that's why we make a plan. And without dwelling on this too long, RIPIN is not Alice. We're not one person. And we're not making one decision about which road to take in a forest. We are 115 employees, 11 board members, more than 40 funders, serving about 40,000 Rhode Islanders every year. And we need to create a shared sense of where we want to end up if we actually want to be successful. So strategic planning for me and for a lot of us at RIPIN is less about the end product and more about the journey and the opportunity to engage with so many stakeholders and to create that shared meaning that allows coordinated action. And that's really what you need, what we need to be successful. So this isn't the first time we've done strategic planning. Our most recent plan ran from 2017 to 2019, and then something happened in 2020 that delayed us on making a new one. I don't remember what that was. There were 3 pillars on our last plan, just to give you a sense of how meaningful these plans are to our organization and the kinds of things that we accomplish when we work together. So professional peers was really about, we have a peer workforce, we're peer-led. It's we hire staff who have experienced the same challenges as our clients. And we wanted to put a lot of work into professionalizing that workforce with training, workforce development, professional development. The community health worker certification didn't exist in 2016, 2017 when we made that plan. And now that is a core of our professional development framework at RIPIN. We're the state's largest employer of certified community health workers. We have about 50 who are certified and another about 50 who are on the path to certification. And it's really at the center of what we do at RIPIN. We've invested tens of thousands of dollars in higher education for staff and engaged in new workforce development grants. So One RIPIN was about really at the time, I think there was a sense that a lot of RIPIN programs were operating on their own and that in silos. And we wanted to do better about coordinating our work. And we built an integrated case management database. We went out and got a grant and customized a system. We're using that every day. We've helped more than 15,000 clients in that database. We've documented more than 120,000 interactions with clients. We built an integrated call center. We used to have 2 call centers, one for special education, one for access to healthcare. If you needed both, turns out a lot of our clients do need support with both of those kinds of things. You had 2 different representatives. We've integrated those processes to make it easier for families to get the support they need. Everyone knows RIPIN was about our public presence, our marketing and communications. Before the plan, each program had its own sort of communications workforce. You know, if they needed a brochure or something, they did it themselves. We centralized our communication staff, professionalized it. We built a new website. We cleaned up and built our social media presence. We refreshed our logo. And thankfully, coming into the pandemic, we did a lot to build up our ability to hold online workshops and webinars. So we accomplished a ton in that period, and it was because we had this shared sense of where we wanted to go. So, you know, I keep talking about our shared sense, and for me, the way you get there is by being as inclusive as possible in building a plan, and we spent a year on this. So we started out talking with consultants who could support us. We had 6 firms bid, and we worked with senior leadership and the board and selected Spartina. And I know that Jen is in the audience, so thank you for all the support that you guys provided to make this a success. Then we built a 15-member core planning team. So that was a diverse group of employees from across the organization, different departments, different levels, different seniority, and including board representation. And they really steered this process. We held 7 listening sessions with almost 200 participants. Those were with staff, funders, partners, clients. Some of them were just for staff or just for clients. A lot of them were mixed audiences. And we held one just for Spanish-speaking clients that we facilitated in Spanish in person. We conducted 16 one-on-one interviews with key partners. We held an all-staff retreat that unfortunately had to be virtual, but I think it's the best we do these days. It was 2 half days, more than 100 participants. And then we put it all together with the core planning team and the directors and the board, synthesized all the information we gathered and built this plan. Those of you who came to listening sessions will remember that we followed a SOAR template rather than SWOT. So that's strengths, opportunities, aspirations, and results. It's a strengths-based approach. And just reflecting back some of what we heard on strengths, you know, we had 7 listening sessions, and I actually bounced between breakout rooms at most of them. So I think I participated in 25 or 30 different breakout rooms talking about RIPIN strengths, which is a nice fun thing for an executive director to get to do. But they all started in the exact same place. It was incredible to hear. Every single one of those groups started with our peer model as being our strength. And what that peer model means for the way clients feel when they interact with us, for the way staff feel when they work at RIPIN, and for the culture that creates around us. So the peer model was over and over again our greatest strength. On opportunities, we heard a lot about our outreach and getting our name out there and having more Rhode Islanders know who we are and know what we do. And especially around the fact that we are now serving Rhode Islanders really across the lifespan. I think we started out and are known for families, but we're also doing a lot of work now with older adults and making sure that our brand and our messaging to the community reflect that. We heard a lot about advocating for sort of system level solutions and doing that in a stronger way. And we heard a lot about reaching out to and reaching into certain communities, maybe more vulnerable communities that have been harder for us to reach in the past, and making sure that we make those investments to be present there. And aspirations and results. that's sort of the flip side of opportunities, really. Strengthening our marketing, strengthening our public presence, our advocacy work. That all adds up to a strategic plan where we have 4 core priorities. And I'll talk about each of these a little more in turn, but telling RIPIN's story, community connections, having the best employees and being the best employer, and forging systemic solutions. So telling RIPIN's story is really about refreshing our brand and especially to reflect the work we do serving Rhode Islanders across the lifespan, and just making sure that that's part of our identity and that the public knows and understands. And then promoting RIPIN much more actively. We would have listening sessions with staff, and staff often say to me, Sam, RIPIN should be on TV. RIPIN should be on billboards on Route 95. And I love that, and that's pride. But I kind of discount it a little bit because maybe RIPIN shouldn't be on billboards on Route 95 or on TV. And we had a listening session with clients, just clients who had worked with us in the past year. And I said, I'm not going to hear this from them. Like, they all found us. They're not going to tell me this. And actually several clients said, we wish we had found out about RIPIN sooner. That you guys have helped us so much, and we struggled for 5 years before our pediatrician told us about you, or whoever it is who referred us. And that really impacted me a lot, and made me think about our obligation to make sure that people know about who we are and the help that we can provide. Community connections, about being a more active, present, and trusted resource in diverse communities. I think the most important part of this priority is a goal to connect with more Rhode Islanders in their neighborhoods and in their native languages. It's about developing and strengthening partnerships with allied organizations that are already there, already doing that work, and being more of a hub, really, a community hub for our communities and our constituencies. Best employees and the best employer, recruiting and retaining the best and most diverse staff with competitive pay, benefits, training, growth opportunities. We can't be RIPIN, and we can't help the community if we don't have the right people. We're nothing more than our people. The labor market's always changing, and we need to always be keeping up. And I think first and foremost there is really not giving up and stewarding and protecting our unique mission-driven peer culture. That's really the #1 non-negotiable for RIPIN. And then the systems work, forging systemic solutions. We help lots of families one-on-one, individually, and that will never go away. But there are often systems level, policy level solutions that can help lots of families at a time. And that's something that's always been part of RIPIN's mission. And I think historically at times we've devoted more attention and resource to that than we have in the past few years. And we heard a lot from the community and from our workforce desiring us to do more of that in the future. And one thing, with RIPIN's peer model and the amount of service work that we're doing, I think we're uniquely placed to really bring the voices of those with lived experience into policymaking. And that's something that will be one of our core focuses, and striving to eliminate racial and ethnic disparities in the systems where we're working. So the healthcare system, school systems, healthy aging systems. So those are the 4 pillars. One of the things I mentioned a few times, sort of refreshing our brand and identity. One thing that came up a few times as well was our mission statement. And does that really reflect what we do? This is our old mission statement from a few months ago. And I don't think anyone said that we have the wrong mission, but I think I heard from some people that we could do to refresh our mission statement. This one's a bit of a mouthful. And so this is our new mission after our planning process, which is that we are peer professionals on a mission to help Rhode Islanders of all abilities, ages, and backgrounds get the support they need to thrive. I think it was important that we had the concept of the peer model directly in our mission statement. It's our #1 strength. and calling out that we're helping Rhode Islanders of all abilities. So absolutely, we have a historical expertise in working with children with special needs and their families, but we're also working with Rhode Islanders who don't have special needs and across the age spectrum as well. This was our old vision statement. Again, maybe a bit of a mouthful for people, and we have streamlined that a little bit to a Rhode Island where systems work for the people who rely on them, driving improved and more equitable outcomes. So these are not, again, I want to stress again, not a new mission and a new vision, a new mission statement and a new vision statement that hopefully are a little more succinct and better express the work that we're doing today. So what comes next? I don't know if any of you have heard the Aesop's fable and Belling the cat. So there's a group of mice and they have a problem, a challenge. Every time they go out to get their cheese, there's a cat who attacks them. There's a cat in the house. They don't know what to do. They're not able to eat. And they get together and they decide to make a strategic plan, to develop a strategy. And they work and they think and they have breakout rooms. And then eventually a really clever mouse raises her hand and she says, I know what we'll do. We'll put a bell on the cat. We'll hang a bell on the cat's collar. And then when the cat's coming, we'll hear that it's coming and we'll get away. And everyone cheers. What a great idea. Problem solved. They start to walk away. And then a wise old mouse in the back stands up and says, wait, but who will put the bell on the cat and how will they do it? And then they're all sad again. And that's kind of where we are in our process. We are at the point where we know what we want to achieve. And we're starting to drill that down into a little more specifics of how will we do what and who will be responsible for doing what. And that's a process that we're starting, and it's a process that we will never finish because that's the nature of a strategic plan. There's constantly new opportunities and new ways to think about how to achieve your goals. We have actually, I presented this plan to staff about a month and a half ago. And since then, we have applied for 3 or 4 new grants. And on each one of them, the strategic plan that we built helped give us direction on how to approach those opportunities. You know, sometimes these kinds of plans can seem daunting, and I don't want it to be that way. Small changes, small investments today can lead to big differences in the future. It's not meant to be overwhelming. And this again is the 4 priorities from our plan. And like I promised at the beginning, I'm remembering to thank everybody at the end. Thank you for all you do to help RIPIN and for all that you will do to help make this plan a success. And I am here hanging out and available if folks have questions, want to talk about anything. Also free to go, but thank you for all of you who contributed to this process. We're very, very excited to work on this with all of you.